For this shoulder examination, we'll be looking at the sternoclavicular joint, the acromioclavicular joint, and the glenohumeral joint. We are looking for any type of swelling or redness at any of these articulations. When looking at the glenohumeral joint, we'll be comparing it with the other side because when swollen, the glenohumeral joint swells anteriorly. At this time, we will also be looking for any muscle atrophy of the deltoid, the supraspinatus, infraspinatus, or the teres minor. If there is any atrophy of the deltoids, instead of having this round curvature of the shoulder, you will have more of a square-shaped shoulder. It is also important to look for any malalignment of the shoulders. This is why it is important to compare both sides. And we are also looking for any winging of the scapulas. The second part of the shoulder examination consists of feel. We will begin this from the medial aspect and work our way to the lateral part. We will begin with the sternum, palpate up the sternum towards the sternoclavicular joint. We'll palpate here for any tenderness. Follow the clavicle, the medial convex area of the clavicle towards the lateral concave aspect of the clavicle till we find the acromioclavicular joint. We'll palpate this as well for any tenderness. On the lateral aspect of the clavicle, right below there, we will find the coracoid process and check that for any tenderness. And then lateral to that, we will find the glenohumeral joint line, which we will also check for tenderness. Going back up to the acromion, we will work our way to the lateral aspect of the acromion. Below the acromion, you will have a subacromion bursa. This is best palpated when the shoulder is extended because the bursa is moved anteriorly, and it can be best palpated this way. Posterior to that, you will find the deltoid, the subdeltoid bursa. Back on the acromion, towards the humerus, if the shoulder is externally rotated, you are able to feel the bicipital tendon, which is located in the bicipital groove. We will then palpate down the humerus and then onto the spine of the scapula. And we're checking for any tenderness. At this time, we can also check the muscles, the supraspinatus, the infraspinatus, the teres minor, and we're checking for tenderness, and the upper part of the trapezius. When conducting the shoulder examination, it is important not to forget to check the axilla. We will check the medial portion of the axilla, the lateral portion up to the humeral head, behind the pectoral muscle for lymph nodes, and the posterior aspect for lymph nodes. We will conduct a formal active range of motion test. We are looking for the smoothness and the extent of the movement. Okay, Mr. Camacho, can you abduct your arms to the sky for me? Okay. Bring your arms behind your head and push your elbows back. Bring your arms back above your head and turn your palms out. Drop your arms down to the side slowly. With your left arm, touch your right shoulder. Go ahead and relax. With your right arm, touch your left shoulder. Go ahead and relax. Can you flex your shoulders up above your head in front of you? Go ahead and bring them down. And bring them behind you. Go ahead and put them back to your sides. Reach behind your back as if you were scratching your back as high as you can. Reach behind your back as if you were scratching your back as high as you can. Okay. Do a push-up on the wall. At this time, we are looking for any winging of the scapula. If there is a problem, there's a problem on the lateral scapulothoracic nerve. Okay, go ahead and turn around facing me. We're going to check internal and external rotation. Okay, go ahead and place your elbows at a 90-degree angle like this. And can you externally rotate them? Bring them outward. And then go ahead and bring them inward towards your body as if you were giving yourself a hug. Thank you. Next, we're going to go through 3 different tests to check for impingement. The first test, we hold the acromion down and passively abduct the patient's arm. Do you feel any pain, Ms. Guzman?
No.
Okay. The second test is the Nearest test. We'll flex the arm up and internally rotate. Do you feel any pain, Ms. Guzman?
No.
Okay. And the last test is the Hawkins test. We'll flex the arm to 90, flex the elbow, abduct, and internally rotate. Do you feel any pain, Ms. Guzman? Thank you.
No.
Thank you. Next, we're going to do a few formal tests to check the rotator cuff muscles. Okay, Ms. Guzman, can I get you to flex your elbows to about here? Okay. We're going to abduct your elbows to about 15 degrees. Okay. Can you hold this position? I'm going to try to move you, okay?
Okay.
Okay, thank you. Can I get you to bring your arms out in front of you? This next test is called the empty can test. We're going to pretend like we're emptying out the bottle. Okay. I'm going to push you down, but don't let me move you. Okay. Thank you. On this next test, can I get you to bring your arms up back here? And make sure you keep your elbows tucked into your sides. Bring your hands outward. Thank you. I'm going to try to push you inward, but don't let me move you. Okay, thank you. This next one, it's just about the same thing, but pretend like you're hugging yourself. And I'm going to try to pull you outward. Don't let me move you. Okay. For this last one, can I get you to turn around and face the back wall for me?
Sure.
I'm going to get you to reach down behind your small, but don't touch your skin. Keep it a little bit outward. Okay?
Okay.
I'm going to try to push you towards your body. Don't let me move you. Okay, perfect. Thank you, Mrs. Swan.
You're welcome.
Okay, Ms. Pierce, this next test is the Jurgensen's test. If I can get you to put your arm in this position, okay, and put your palm facing upward. Okay. What I'm going to do is I'm going to try to turn your hand facing downward. If you can just try to keep it in this position and resist me, okay? Okay. Do you feel any pain?
No.
Okay. The next one, can I get you to put your arms out in front of you with the palms up? Okay. And I'm going to press down. Don't let me push you down, okay?
Okay.
Thank you. Okay, Miss Pierce, now we're going to do another test to check your acromioclavicular joint. If I can get you to reach across your chest to the other side of your hand, and I'm just going to put some pressure. Let me know if it hurts. You okay?
Mm-hmm.
Okay. Now can I get you to reach behind your back, and I'm also going to apply some pressure. Any pain?
No.
Okay. Thank you. Okay, Miss Pierce, now we're going to go through a few glenohumeral joint stability tests. Can I get you to turn around that way for me, please? Thank you. Okay. I'm going to check for your anterior stability, posterior stability, inferior stability. Okay. Now we're going to do the apprehension test. If I can get you to bring your arm out. Okay. I'm going to flex the elbow and externally rotate. Okay. Thank you, Miss Pierce.
You're welcome.
Hello, Miss Pierce. Today we're going to do a quick check of your myotones. Okay?
Okay.
If I can just get you to hold this position for me, and just let me know if you have any pain while I press down.
No.
Okay. Now, can you hold your hand out this way for me? Okay. And can you hold it down here behind you? Thank you. And can I get you to do this motion for me? Like come here, come here. And can I get you to do a 5 for me? Thank you. Okay, Miss Pierce, now we're going to look at your dermatomes. We're going to take a look at C5, which is found on the lateral aspect of your arm, and C6, which begins at the tip of the thumb, C7, which begins in the long finger, and C8, which is at the pinky, and T1, which can be found on the medial aspect of the arm. Thank you.